Bismillah Rahman Rahim. Today we will discuss oxytocin. So it is a hormone which is synthesized in the hypothalamus and stored in the posterior pituitary gland. After the synthesis, oxytocin will transport it to the posterior pituitary gland through the nerve fibers of the hypophyseal tract. Now, after synthesizing, the release of oxytocin need two stimulators, and these stimulators are first parturition or labor, second suckling, and third coitus. Now, the pharmacological action of oxytocin and the different parts or organs or different systems of the body. First, on uterus, oxytocin stimulate the contraction of the pregnant uterus. Only pregnant uterus, because the non-pregnant uterus is insensitive for the oxytocin. Oxytocin increases both the force and frequency of the uterine contraction. Second, on breast, oxytocin contract the myoepithelial cells which lines the ducts of the mammary gland or milk duct of the breast and causes ejection of the milk. Third, CVS or cardiovascular system. If oxytocin given in high dose, it causes the vasodilation and transient hypertension, I mean for short time, and also tachycardia. And this condition is so dangerous because it may lead the child giving mother to stroke, which sometimes may occur. Fourth, on kidney, if oxytocin given in large dose or high dose, it can produce ADH-like action, which are antidiuretic hormone, so the urine output will be decreased. Now, uses are indication of oxytocin. Number one, induction of labor. Oxytocin is the drug of choice for the induction of labor and is administered by IV infusion. Here some point should be remembered. Dose of oxytocin should be adjusted according to the contraction of the uterus, because oxytocin at high dose may cause fetal asphyxia. Second, the plasma half-life of oxytocin is so short, nearly for 6 minutes, so its action can be terminated by stopping the infusion immediately. Third, at the low dose, there is a complete relaxation between the uterine contractions, and this relaxation of the uterine contractions help to maintain the blood flow to the placenta and the fetus, which prevent the fetal from the asphyxia. Second, postpartum hemorrhage. Oxytocin is used for the prevention of postpartum hemorrhage. Postpartum hemorrhage means the blood which occur after delivery. For the prevention of postpartum hemorrhage, oxytocin should be given IM or in IV infusion, and for the treatment of postpartum hemorrhage, it should be give IV infusion. Third, for the milk leg down, oxytocin may be useful in breast engorgement, stimulate the myoepithelial cell, resulting in the milk lay down. Now, the adverse effects of oxytocin. Number one, uterine hyperstimulation. Overdosage of oxytocin can cause strong uterine contraction, which can result in uterine rupture, fetal asphyxia, or even fetal death. So, oxytocin should be given in low dose and slowly. Second, if large amount of fluid is infused, I mean if oxytocin is diluted with large amount of fluid, it may cause water intoxication, which lead to headache, vomiting, drowsiness, and convulsion.